And now we are joined by Catherine Kroll, an infection prevention leader at PeaceHealth. Catherine, thank you so much for joining us. Our first question for you tonight, are you focused on guidance? Is PeaceHealth focused on guidance from the West Coast Health Alliance or the CDC?
So we're balancing both, and we're really fortunate to live on the West Coast where our leaders have leaned in and gathered to understand what the needs are and what the science says. So for us at Peace Health, we're going to be following the West Coast Healthcare Alliance recommendations and assuring that all of our patients and our healthcare workers have access to the vaccine, both COVID, influenza, and RSV, as it's outlined in the West Coast Health Alliance recommendations.
Okay, thank you very much for that, Catherine. Are you required to follow these guidelines from the West Coast Health Alliance? Is this, required of PeaceHealth, or is this more just advice and you can kind of then take it in as an organization and approach it the way that is best for your organization?
For us, it's not so much about the requirement and whether or not we're legally mandated to follow the West Coast Alliance. It's about making sure that the patients who want to have vaccines have access to it. And so we will be following the West Coast Healthcare Alliance recommendations so that people have the choice if they want to be vaccinated.
And now that the COVID-19 vaccine no longer requires a prescription, is PeaceHealth concerned at all about the supply currently?
We're not. We're really excited to be able to offer that. And frankly, it was a major burden on our healthcare providers to be trying to write prescriptions and assure that patients got those prescriptions to take to their pharmacies. The way that the COVID vaccine has been rolled out, the folks who are best positioned to distribute this in the community are the pharmacies. And so for us, that meant there was an extra layer of requirement for our healthcare providers to give the prescription and then push it to the pharmacy. So this removes that barrier that existed and reduces the burden on our healthcare providers who have a very busy schedule as is. The other piece I want to offer a caveat on is that in Oregon, anyone over 7, the pharmacist is able to provide that and write that prescription. For those who are under 7, our understanding of the guidance that was put out and the pharmacy board information is that it will still require a prescription for those who are 6 months to 7 to get that COVID vaccine. So we've assured that we have processes in place to provide those prescriptions as needed.
I'm wondering how the changing guidance on vaccines, whether it comes from the federal government and now from this West Coast Health Alliance, how that has impacted your providers. What is the communication you've received from them about how they've been managing care during these, some of the confusion or some of these discussions?
The providers that I spoke to today were very welcoming of the Healthcare Alliance recommendations because it removed a lot of the confusion. It's been really confusing to hear, well, in the state of Washington, you can do this. In other states, you can't provide it without a prescription. And so what really helped us today is that clarity that guidance provides, which means that we have a clear path forward to get those who want to receive the vaccine access to it.
Okay, a lot of good information, and I'm sure we're going to continue to, look into how this changes or potentially new guidance that's issued by the West Coast Health Alliance. We are pleased to have you on. We may ask you to come join us again sometime in the future. Thank you, Catherine.
Thank you.